Perfect.
All right.
Awesome. So we should be all set.
Thank you. Good morning. My name is Jeff Cleaver, and I'm the Executive Director of the Business Healthcare Group. And I would like to welcome all of you to the BHCG Delivering Value Series Symposium on the future of healthcare analytics and employee benefits. I would like to thank all of you who have joined us this morning for taking time out of your incredibly busy days to participate in our symposium. And we are very excited about the program that we have set up for all of you this morning. And just as importantly too, I would like to thank all of the individuals, the presenters and the panelists that have joined us, and the amount of time and effort they've put into preparing for the symposium this morning. So the agenda for the morning is I'll have some opening remarks, and then we'll move to setting the stage, the value of data, with Dave Ostendorf. And Dave will do, and all of the presenters and panelists will do a self-introduction when I'm done with the agenda. And then we move to the Artemis health story with Grant Gordon. And then we go into a panel discussion on the Artemis Health Partnership with employers with Grant, with John Sine, with Sanjay Motwani, and with Kate Schirkenbach. And then we'll open it up for Q&A and then closing comments. And then Jamie Earhart is going to do a platform demonstration. Now, if at any time you have questions, you can enter those into the questions box. And we will then address those So with that, Dave, and self-introduction.
Good morning, folks. Dave Ostendorf. I had the good fortune of being the long-term strategic advisor to the Business Healthcare Group and working with them and pushing forward the mission and the vision here. I also work as the chief actuary at Centivo, so I've got the cat out of the bag. I am an actuary, so I love this topic and looking forward to the conversation today.
Grant.
Hi, my name is Grant Gordon. I'm the co-founder and CEO of Artemis Health. Started out my career as a software engineer, but been in the healthcare business for almost 10 years now. So I'd like to say I've got an honorary advanced degree in healthcare analytics, and really excited to spend some time with you all today.
Thank you, Grant. John?
Hello, my name is John Sine, and I'm the manager of benefits, wellness, and leave at Holman, a global automotive firm with 6,000 US employees. And we're one of the employer groups that partner with Artemis that helps us synthesize, all of the data in the areas that, I oversee to make strategic and long-term decisions that are best for us as a company and for our employees as a whole.
And John, how long have you been a client of Artemis?
2.5 years now.
Okay, thank you, John. Sanjay?
Good morning, everyone. My name is Sanjay Motwani. I have the privilege and honor of leading strategy, development of products and operations delivery for all of Artemis clients. My background has been in strategy and solutions. And then for the last 14 plus years, I've been smitten by healthcare, working across payers, providers, and now employers, especially using data to create insights and then delivering actions based on those insights. So would love to share our experiences and stories based on the value that we bring to employers and partnerships with organizations like BHCG.
Thank you. And Kate.
Hi, I'm Kate Schirkenbach. I'm the Total Rewards Manager at Baird. Baird, for those of you who are not familiar, is a financial services firm. We have almost 5,000 associates throughout almost all the states, 40 plus states. So a very disparate workforce, a very educated workforce, and that has both pros and challenges as well. So we began implementing with Artemis earlier this year. So we anticipate moving to some user testing next week. So we're very excited about that.
Very nice. Thank you, Kate. So the business healthcare group has in place a number of best-in-class strategic partnerships for healthcare, medical, our third-party administrators, Centivo, for pharmacy benefit management. Our partner is Navitus. For employee advocacy, it's Quantum. And then we also have a partnership in place with Teladoc, formerly, and Teladoc purchased Best Doctors, and we had a long-standing relationship with Best Doctors. And so I have a steering committee. The steering committee is essentially my board of directors. And they came to me and indicated that many of them were very dissatisfied with the data warehouse solutions that they had in place. So what we did is we put into place a work group to identify potential, best-in-class strategic partner for data analytics. And we actually spent almost 2 years in identifying who we were going to move forward with. And the rest of the story is that partner now, the best-in-class strategic partner for data analytics is Artemis. And we are very lucky to be able to have the partnership that we have in place with Artemis. And it really fills a black hole that we had, and it supplements and replaces those, and I'll call them vendors for our member employers who are not meeting the expectations of our member employers when it came to data analytics. And so that's a very condensed background on how we developed the partnership with Artemis. Now, with Artemis, we have in place what we consider to be best-in-class threshold pricing. And that best-in-class threshold pricing is based upon the total enrollment that we have with Artemis. And we also have negotiated terms and conditions that we feel are, once again, best in class with Artemis. And to us, to the business healthcare group, being able to arrive at the pricing that we arrived at, and also the terms and conditions within our master service agreement, and also within the client service agreement for clients of Artemis, that truly demonstrates the partnership between BHCG and Artemis, and also on a go-forward basis between Artemis and clients. And we have been in other situations in attempting to put into place best-in-class strategic partnerships. Did not go as easily as it went with Artemis. And again, I'll reiterate that truly demonstrates their commitment to moving forward a data analytics solution with business healthcare group and our member employers. So with that, and then the other, and another point that I think is very important for everyone to understand. So Kate indicated that Baird is moving forward with Artemis within the BHCG solution. BMO, a large banking firm who is a member of the business healthcare group, is doing exactly the same thing. Artemis just received a commitment from one of our largest member employers 2 weeks ago for them to move forward on 1/1/23. So we have a great deal of movement within our organization to utilize the Artemis data analytics solution. And I'm confident that we will see significant growth in this best-in-class strategic partnership for our current member employers and also for prospects within BHCG. So with that, Dave.
Thanks, Jeff. And, as we talk about data in healthcare, if you think about healthcare in general, there are a few industries that frankly have more data available to it, more opportunity to use data, more just various sources of data that are out there. And historically, you think about it, the data in healthcare from the claim side has been around for decades. And it's been fed into data warehouses. In dating myself, I could think back to the late 80s and 90s when I was working with the automotive industry, and we were looking at MedStat data, and that was sort of the initial precursor to a lot of it. And you should think about the progression. We've gone from having claims data to the movement from paper to digitized records around electronic medical records, to the look at what happens when we start to run incentive programs and how incentive program providers can bring data to play, how we look at disability management kind of programs, how we look at sort of the next generation of all the point solution providers. The increasing amount of data availability has been important. And yet in healthcare, frankly, we've used data, I think, relatively ineffectively. And part of that has been because the scope is so large, because the complexity of healthcare creates challenges, and because healthcare itself has not leveraged technology as effectively historically as we'd like it to. We've always had challenges. And so there's been an opportunity to make improvement. Jeff noted that there was sort of a black hole in the BHCG menu of solutions. Data itself has sort of been a black hole. For years, we have had lots of data, but not lots of information, and in particular, not lots of actionable information. So for those of you who are used to having your health plan come in with reams and reams of paper and put a big stack of numbers on your desk and say, here's how your health plan's doing, there isn't a lot of actual opportunity there. So as we think about what's new and different, excuse me, we think about where the opportunities go. I like to think of data in the healthcare space really in 4 buckets. The first one is sort of the standard, blocking and tackling of having your financial reporting data, being able to say, how is our plan spend going? What kind of information is my CFO going to want to see? Really the sort of CFO controller side of the world. What kinds of numbers do I need to be tracking? There's a second bucket of data, which is really, I think, become a next level of meat and potatoes, which is really the clinical health status of my people. What do I know about where their health risk factors are? What do I know about how I'm changing that, if at all? What do I know about what's driving some of my claims relative to underlying health conditions? Those are things that are important and necessary, and information that we can feed back within our organizations to say, these are some of the targets we're really after. So that's important data, and again, sets a good framework. But then we go into maybe the more progressive uses of data. One of those is really looking at some of the initiatives we've all taken on, whether it's putting in wellness incentive programs or creating a structure of point solutions, or looking at all kinds of different interventions we've made. We really need to use the data to ask ourselves a basic question. Have the interventions we put in worked? And are they something that we should say, let's just keep going where we are? Are they something we should be doubling down on and really pushing harder on? Are they something that we're saying, frankly, isn't working very well and we should discontinue? And one of the biggest challenges we've had in healthcare is it's hard to stop something once you've started it. Nobody likes to admit that we made a bad decision, but the reality is healthcare is a perfect place to say, if it's not working, let's get rid of it. So that whole question of how do we evaluate interventions and what is a true ROI, as opposed to simply what our vendors are telling us the ROI is something that really creates an opportunity. And then the fourth bucket really is the future looking bucket. It's looking for opportunities. It's looking for possibilities that we either haven't seen before or have only partly recognized. What kinds of things should I really be doing within my program? Where are the gaps? What kinds of opportunity I have not only to work with my people, but potentially with the provider community as well, in terms of making real advancements. I tell you from the BHCG perspective, one of the things that we have found in the last few years is that the use of data to really drive behaviors both at the patient level and at the provider level is something that we can as employers impact and need to take more advantage of. We need to have good, solid, robust data behind that. And that's something that an organization like the Business Healthcare Group and aggregating a number of progressive employers can really put some attention to and really create some momentum for. So that whole question of, how do we get progressive? How do we get out ahead of things? I think those are critical opportunities that really will help reinforce the value of data. So with that, I'm going to turn it over to Grant and let him talk a bit about where Artemis is and give some thoughts on those topics. Grant.
Thank you so much. Really excited to be here today. Once again, my name is Grant Gordon. I helped start Artemis and real data nerd. And I'd love to just tell you the story of how Artemis came to be and what we stand for before we hop into this panel here, which is arguably the more interesting piece, but this will give you some context. 3,316 days ago, two co-founders and I got off a red eye in New York City. And the only thing we really knew was that we wanted to do something good with our lives, and that we thought that probably there was something in healthcare that we could apply our skills in data and software to. Excuse me, let's go to the next slide. And you always hear about people saying healthcare is broken. But if we advance here, we thought we understood what was broken, but the deeper we dug, the more we realized that this was a real iceberg kind of situation and didn't seem to be a bottom. And luckily, we found some investors who believed in us as a team and just wanted us to find something to do. And so they put us up in their office on the next slide, which was a loft in Soho. And I don't know why they decided to spray paint their investments logos on the walls, but they did. So it was quite a unique atmosphere. And we dug in and we started just trying to map out healthcare and who was doing what and where the problems seemed to be and where the leverage seemed to be. And we learned a ton. And I don't need to tell you about how employers are one of the only constituents in healthcare that actually cares about people, their health and well-being, as well as the cost of their healthcare. But that really lit our fire, and we knew that's where we wanted to dig in. And that's why on the next slide, you'll see that we decided to focus on empowering employers and their advisors to optimize their health benefits using data. Optimization is actually kind of an understatement. There is so much waste and so much opportunity to help people just waiting for us to identify in that data. And that's really what gets us out of bed in the morning. And this isn't commonly known, but it actually took us 2.5 years from that point to get our first customer, because we just had so much to learn. And we spent, literally years doing nothing but talking to benefit teams, showing them our designs and prototypes, learning about their world, iterating. And we still carry on that tradition today. But 2.5 years in, our first two customers, Nielsen and Intuit, raised their hand and said, in addition to this feedback, we'd also like to work with you, which was extremely exciting for us. And what we iterated to, let's go to the next slide here, is a platform that integrates all of your benefits data, not just the claims and eligibility. And that took a ton of innovation behind the scenes that nobody ever sees, to do things like link members when you don't have clear IDs and figure out how to get that 360-degree view and cross-analyze data sets that aren't normally cross-analyzable. But the dream here and what we've been able to do with our customers is to help them figure out, of all the programs they have in place, what's working and what's not. And then what else is the data telling them that they should be doing, so that they can then place that bet and then turn around and measure it in Artemis and really kind of run that scientific method, be a truly data-driven benefits team for the benefit of the people that they're in charge of, that they have stewardship over. we have a lot of integrations. When I think back to that first implementation, it felt pretty daunting. But luckily we have an amazing team that's grown a ton over the years. We've done a lot of work. We have a really scalable data platform, and we're really excited to hopefully bring this to bear for you so that you can execute on your missions as effectively as you want to. So let's go to we're going to flip through these slides pretty quickly here. Just to give you an idea of the scope of Artemis and what we've done and where we're going. It's been 9 years, and we've had, let's go to the next slide, 5 offices. And we raised a whole bunch of money. On the next slide, we raised $60 million from some really incredible investors like Bessemer. And we've had hundreds of amazing people work with us. On the next slide, like team members from the industry, from some of the incumbents that you know, from people from tech, people from out of left field, just have a lot of heart and really believe in the mission and willing to work hard and apply their incredible brains to pushing this forward. Let's go to the next slide. We've shipped thousands of versions of our software. We ship very frequently. We are fixing things and improving things all the time. And tons of work from our amazing R&D team there. Let's go to the next slide. We now have over 12 million lives represented in the data on our platform and growing very rapidly, which gives us more and more breadth to develop models and do benchmarking and bring value to you and your members. And on the next slide, you'll see that those 12 million plus lives are represented in about 600 employers that we work with who are just incredible, like many that you've heard of, like Google and Amazon and Boeing, many that you haven't, but you're in good company if you, BHCG is a really good company here. We're really excited and really kind of pinch ourselves with the kinds of amazing people that we partner with. And last thing here is, you may have heard that we've had one acquisition, or rather we were acquired on the last slide or the next slide. A company called Nomi Health, who I've known the founder of for over a decade, approached us last year and wanted to join forces. Nomi has grown exceptionally quickly and is very, very good at taking action. They developed a lot of health, like everyday healthcare services for government customers during the pandemic, both COVID related and not, and have some incredible tech on kind of real-time payments and things in the back end. And we have a ton of insight. And so putting their action and our insight together, I think over the next few years, we'll be able to create some really amazing products that'll really help a lot of people. Super excited for that, really exciting strategic fit. And we're really just getting started. You know, on the last slide here, it's been 9 years, but we are just as excited today as we were the day we started the company, probably more so because we see all the opportunity here. And we're really excited to partner with BHCG. We love partnering with passionate groups that really want to have an impact. I always say personally, if I just wanted to get rich, I would have started a different company. What matters to me, gets me out of bed in the morning, is having that impact and really helping people. We really believe that BHCG is that kind of partner. And if you're working with them through the transitive property, we believe you are too. So that's a little bit about Artemis. We're really excited to be here today. And hopefully we can have a good panel, and we look forward to your questions.
Okay, thank you, Grant. Do appreciate the insight. So with that, let's move to the panel discussion. And so with the panel discussion, Dave Ostendorf is going to lead the discussion with Grant, John, Sanjay, and Kate. And once again, if you do have questions, please enter those into the question box, and those will then be answered when we get to the Q&A. So with that, and we really want this to be, even though, this is a virtual presentation, we really want this to be as informal as possible. So we would love to receive questions from all of you. And if for some reason we're not able to answer one or two questions, we will certainly get back to you with answers after the meeting this morning. So with that, Dave, I'll turn it over to you.
Thanks, Jeff. So I'm going to start with a question that came out of some of the comments that we just heard and some of the introductory comments. There was a lot of discussion of partners and partnership. And, one of the challenges we've always had in healthcare is everybody wants to be a partner because that certainly sounds good. But the whole question of what does it really mean to be a partner is I think one of those things that needs to be addressed more directly. And I look at this panel and I say, we've got, employer representatives here. We've got the folks from Artemis. Obviously, this is something that is being sponsored by the Business Healthcare Group, which, as a mission-driven coalition is a group that really, tries to have a significant impact in what they do. So you've got a number of players here. So let me start with just a basic question for the panel. When you think about, this area, what does partnership really mean? And what does it look like when you see a successful partnership in this space? I'm going to start with Grant, and then I'm going to go to the employers and get their thoughts and see if we have agreement on what the definition of partner really is.
That's a really good question. And, we made a really deliberate decision a few years back to shift our business model from a direct enterprise where we're out selling directly to employers to working with a limited set of partners. And the reason why we wanted to work with a limited set of partners, it's kind of counterintuitive for a business, is there are plenty, there are partners that are big enough that we could work with, their coalition members or their clients, and we would build a really fantastic business. And if we spread ourselves too thin, then this becomes a transactional thing and we lose our focus on having an impact. And so, we look for organizations that we can go deep with on a number of fronts. One, just for driving adoption, we want to be there. We want to show up at these kinds of meetings. We want to show up at their conferences. We want to do training for them. We want to co-market with them. We want to go really deep on just driving adoption in the first place. But once we have that, we really want to go deep on figuring out priorities and trying to build, groups of employers that are trying to tackle the same challenges, gathering input to improve the product as we continue, getting new ideas for new analytics. We really want this to be a collaboration so that over time we're driving more and more and more value on every front. And that goes for the software, it goes for the services, it goes for the support. Top to bottom, we really have tried to pick a small set of partners so that we can go to that kind of depth.
So John, how do you react to that? And what's your thought around the whole question of, is this a partnership or is it a buyer-vendor relationship?
This is not a buyer-vendor relationship. Initially when we were going through our marketing effort 2.5 years ago, 3 years ago, really, we were looking for a data warehouse solution that was nimble, something that when we saw results, we can then, create explorations and dig deeper into that value. And what we realized was that, Artemis was one of the only vendors in the space that could do exactly that. That an individual like myself that understands data, but is not a programmer and is not used to a data warehouse, I was able to, with their training, pick this up very quickly. And to echo some of, Grant's comments, really to me, what separates, a partner versus a business vendor relationship, because at Holman, we have a lot of vendor relationships. It's a group or a company that understands what we are trying to do. What are our priorities? And at home, and we have a fantastic technical lead on our account that we meet with bi-weekly that understands what we're trying to do and are proactively creating stories, identifying explorations, and are kind of a trusted partner of ours. And that's probably the differentiating keyword. I trust Artemis. I trust the data scrubbing process that they do, and that ultimately when I am looking at this data and I am making recommendations, decision on this data, I know that it is accurate and that I can put my reputation and my recommendations on the line with that. And I think that is, what I've been able to see over the last, 2.5 years. And they're really pushing me to look at new ideas. And with their other employer groups, the shared experiences that they're able to provide has been a huge assist, right? Because sometimes I'm very myopic in what we're trying to do. It's like, here's the problem, how do we solve it? And Artemis has done a great job in helping us zoom out, look at the larger data set, and then helping us refocus and zoom back in. So I know today that when we are, presenting our 2023 strategy, we would not necessarily have the backup information needed without having the data that comes from a sophisticated warehouse.
Kate, you're relatively new to this relationship, but how would you sort of augment what John just said?
Yeah, I'm excited to hear what John has said because I feel that's what we have in store for us. So at this point, we are, like I mentioned earlier, in the implementation phase. And what I've appreciated is their listening. We're looking for what are their goals as a business and where are they going with their business, as well as they're asking us, what are we trying to accomplish, and really mapping that out. Is that a phase 1? Is that a phase 2? We come to them with, oh, wait, but we forgot to tell you we want this as well. They stop, do not get flustered, and we can do that. We can figure it out. So it's that coming to a common ground and being able to go the extra mile is really what a partnership is. But it takes work, it takes time. I don't expect them to, read our minds. It takes effort for us to instill what our culture of health is. And at Baird, we have a very strong culture of health. And Artemis is one tool in how we continue our culture of health journey. So helping them to understand that it's not a tool, it's not an isolation, but where does Artemis fit in terms of our whole journey towards associate well-being and, as I mentioned, the culture of health.
So, Kay, let's stick with that idea for just a second, because I think the companies that look at a journey down the path of the culture of health have to look at a lot of different elements of data and a lot of different things that they're pulling together.
Mm-hmm.
And it's, it does take, perhaps a more sophisticated process than some employers have done in the past, where it's get my data from my health plan and call it good.
Yes.
So, how do you see the use of the data warehouse to really reinforce that movement down the path of creating the culture of health?
Yeah. So the way we intend on using it is to, as John mentioned, us as well, medical, dental, vision, pharmacy data. We're also pulling in what I would call voluntary benefits, who's participating, and not only in our voluntary benefits related to wellness, but also our voluntary benefits related to financial well-being. Are we going to be seeing a correlation between high participation in the HSA and high healthcare utilization? Or, what patterns are we going to see? So it's taking a much more holistic picture of the person, taking it out of that healthcare arena and really looking what are all the the inputs, what are all the variables that are going on in that person's life? Is it related to ethnicity? Is it related to demographics? I mentioned we're in 40+ states. Are there particular regions of the country where we need to focus a little bit differently, provide different solutions? So just bringing all of those variables together is very exciting for us, and will continue our culture of health journey.
Can you speak to some of the other data feeds that you're bringing in also?
Sure, absolutely. So we have a meditation experience that Baird provides complimentary to associates. So we're able to bring in utilization data, who is using our meditation services, gym discount programs, things like that, as well. Oh, were you going to say something? No.
As well as workers' compensation.
Workers' compensation, disability, short-term disability, long-term disability, and really even who's participating in like pet insurance, trying to understand what is the makeup of our population and what's important to them. So it's reaching into those other voluntary, non-traditional, we wouldn't call pet insurance a traditional healthcare vendor, but really trying to understand patterns and how we can influence.
So you work with an individual in an organization that is run by Dr. Fabius.
Oh, yes. Mm-hmm.
And
Yep.
can you explain that partnership
Sure.
and how this is augmenting what they're able to do for you?
Yep, absolutely.
With Dr. Fabius?
Yeah, so
Sorry.
Baird has started working with Dr. Ray Fabius and his team, known as Health Next. And for a number of years, they've helped us assess our culture of health. And it's assessment of not only the plans we offer, the utilization, but it's assessment of the environment. We're, looking at, what are the physical, what do our facilities look like? How are they conducive to the culture of health? It's what are your programs that are being offered through perhaps, the workers' comp program or disability programs. And it's a series, and I shake my head. There's thousands of data points that we provide to them in terms of how we are evolving our culture of health. They take that data, they're assimilating it, and they have a tool where they actually output a number, and it's benchmarked against other best practices in terms of other employers going down that culture of health journey. And our goal is to year over year to improve our score. But a score is a score, right? I think what is more valuable to us is the influence and the expertise that they bring to us. So Dr. Ray Fabius is a medical doctor, and he brings to us some very experienced individuals who have deep knowledge in the data analytics space. And they are actually helping us guide, as well as helping guide Artemis in terms of creating this data environment that is rich for Baird, but also is rich for Health Next. And they will then be able to help us interpret the data, use the data, offer suggestions for evolving that culture of health.
So, Sanjay, Kate just laid out a path that had an awful lot of data inputs to it to really create a holistic look at their population. And I love it from that perspective, and that it is something that has been missing, I think, in the evaluation. It goes along with the fact that there is so much digitalization of healthcare, both healthcare data in terms of EMRs and that type of thing, healthcare data in terms of delivering healthcare on a virtual basis. The quick growth in technology around healthcare is really an interesting challenge. When you start putting those things together, what do you see as the biggest opportunity for my product enhancement relative to the Artemis piece, especially as it speaks to things like EMR data and things like some of the point solution data? And where do you sort of get your input from the employer community to really guide your development roadmap?
That's a great question, and thank you for that context. We have been very good at, from an employer community point of view, analyzing cost and quality and utilization opportunities using medical claims, pharmacy claims, patient member program eligibility kind of data. I'll call it just bread and butter of what goes into benefit analytics programs. Where Artemis has been already differentiating is by combining those along with dental claims, vision claims, lab results, biometric results, even health risk assessments, which sometimes we get from employers, and then also add on productivity related data like short-term disability, long-term disability. But what gets me really excited and I have goosebumps is around the notion of digitization that you brought in. So we are starting to see patient surveys or member surveys. We are starting to see personal health records. We are starting to look at community-based social determinants. For example, one of our employer partners has employees who are in that income bracket where access to care becomes extremely important for them, and issues like transportation can come in the way of them using the right care setting. And we are using that to help advise how to enable services and programs for that segment of the employee population they have. And then the pandemic obviously has accelerated the shift to point solutions. So when we started to look at point solutions, we realized that employers really were struggling with the efficacy of point solution, because it's not just about looking at whether a point solution has the necessary enrollment. It is more about whether it is driving the efficacy in terms of care, in terms of financial impact, in terms of clinical outcomes, and most importantly, are the members engaged? So we have apart from the core benefit analytics solution that John talked about that they have been using with us, we recently made available a product called as Console, which focuses on diabetes, MSK, behavioral health, weight loss, diabetes prevention, hypertension as some of the areas where we are essentially identifying opportunities for employers to see if the point solution is adding value. Because this train has left the station of point solutions, right? We are going to see large providers start getting into point solutions in their local markets. We are going to see more fragmented marketplace around point solutions, and employers really need the answer to whether the point solutions are providing that ROI and the value, if you will. So we are closely working with partners like you all as BHCG and John and brokers and consultants to continue to focus on expanding the tent of data that we bring in, and then drive solutions like Console, which will help move us in the right direction.
One of the conversation points around data warehouses always, who are they really structured to serve? And you think about there's sort of three layers of that. One is the employers and what they can do on their own within their organizations. The second piece is the advisory community, the brokers and consultants who are looking at data and trying to help support the management of healthcare programs. And then there's the third, probably most intensive users around those who are, the actuaries and the data scientists who spend, all of their time looking at data and trying to get, really deep into the information. Who do you see as your real, as your most focused user? Where do you really put your time and energy on the Artemis side? And then I'm going to flip it back to the employers and say, how do you think about using this both in terms of what you can do in-house and what you should be looking for your advisors to be supporting? But let me start with the Artemis folks. Who really is your target audience, and how do you make the capabilities available to all of those?
Yeah, my favorite thing to say to people who I hire into Artemis across all of these areas that I have privileged to lead is, employers are not, the benefit teams and employers are not clinicians or data scientists. So I have, breadth and depth of experience on the provider and payer side. And there you get to see people who have been doing that for long, and they have that clinical expertise, and they are very, deep into, electronic medical records, as you said. So on the employer side, one of the key tenets that drives us is reducing friction with data. And how we do that is basically through this, three-pronged approach. One is we look at, employers as mostly the benefit teams as consumers of insights. So as, John was referring to previously, they get out of the box capabilities, which allow them to make decisions related to, for example, is there an opportunity for them to launch a, behavioral health program, so to speak, right? Based on looking at the data. The second is, we focus on the advisors, which is brokers and consultants, to really, and the account managers and consultants there, to be able to identify opportunities that they can explore along with their employer partners related to benefit design, related to point solution assessment, identification, or even groups like BHCG, who are able to bring certain best-in-class partnerships to the table, right? And then lastly, there are, especially in the broker consultant community and some of the largest employer, they do have, folks who can be called as citizen data scientists, who really, are not afraid of looking at, for example, actionable overspending as a problem, through our platform, and they are able to look at, opportunities beyond medical and RX related to that, and then they can identify, what is the right solution and track it, through its life cycle. So I think we have learned that, we really need to help keep reducing the friction that exists with data, because it is complex, it is vast, and then, benefit teams are not clinicians or data scientists. But that we do by this three-pronged approach, out of the box insights, which you can use to make decisions. Second is empower the broker consultants to really identify opportunities. And then third is these citizen data scientists, just make it easy for them to do their magic.
So John, from your experience, is Artemis mostly a tool for you? Is it mostly a tool for your advisors? Is it, how do you, think about it in terms of the actual use case here?
For us, Artemis is mostly used by Holman. We have a direct deal with them. We are partnering with their data scientists to kind of understand what we are trying to do, and then how they can support that. When we first came on board, I'd say it did take us about a year for us to truly understand our data, right? We were always used to seeing carrier reporting or ad hoc reports. And this was our first chance to now see, we loaded 3 years of historical data. We were getting monthly updates. We almost didn't even know like what questions to ask, because now everything was at our fingertips. And through those out-of-the-box solutions, it helped ground us into understanding, the risk strata that we had, the year-over-year trends, and how we could utilize it. But now, being 2.5 years in, we know the type of questions to ask, how to best leverage Artemis. Because like Sanjay said, I am not going in there and creating, complex stories or explorations. I am giving a vision to our team, and then they're saying, well, you know what, we already have a story built, or let's use some of the, the data hours that you have to build something out specific for you. And then once we have that information, we are capable enough to then look at that, do some explorations off of that. And that just means like kind of drilling into it deeper. But from our perspective, it's been really helpful to just understand the ups and downs of our claim history, the interactions of our various point solutions, and ways to, best address, some of the concerns that we have coming out of, the pandemic. One such great, data pullout that they had was, we're concerned that, we saw the ramp up for COVID, but are people still going to get care? And very easily, and I'm talking within a day, they were able to show us, here are the individuals that are getting, a preventive exam. Now let's dig in deeper and split that out by those with and without chronic conditions. And now we know that if an employee that doesn't have a chronic condition, on average, they are only 40% likely to get an annual physical. Those that with a chronic condition, it only goes up a little bit more, 60%. So now we're like, okay, here is an emerging risk that we have, because historically our annual physical rate was 70% or more, and now we're significantly less than that. So our employees aren't getting that preventive care, and when they are getting care, it's much more severe. And that has been extremely helpful to kind of dig deeper into our data to understand, like, how are our employees interacting with the healthcare system, to make sure that they are taking advantage of our wellness programs and the benefits that we make available to them.
Just one more thing to add there. We have an excellent resource to partner with, folks from the employer community and broker consultant. We call it an analytic advisor. And they essentially become part of the employer or broker consultant in terms of their need to, connect the dots with the data. So while we have, obviously out of the box capabilities, we will also, where needed, provide this resource to help them just identify nuances related to their own organization.
So Kate, you're in the process of implementing, obviously you went through the evaluation of this as a solution. Now you're into the nitty gritty of, so who should have access? How are we going to use it? Really the whole question of just sort of the day-to-day interactions. What does that feel like for you, and what kind of process have you gone through, and what decisions have you made as to, who should get their hands on this thing?
Right. It's evolving, right? It's the total rewards team, first of all, but then what levels within that will we have access to? It goes up to our CHRO, who is very interested in the data. Do we want him to be able to touch the data and manipulate it? Not quite so sure, but he will have access. I mentioned Health Next, and I wanted to clarify, Health Next would not be considered a broker consultant. We have a broker consultant partner. Health Next is really a consultant, for lack of a better word, but they're really a partner. So they are an extension of our total rewards team. So absolutely, they will have access to the tool. As I mentioned, one of the individuals on the team, I'd consider him a data scientist, and I really anticipate he'll be able to help us maximize use of the tool. I also anticipate Dr. Ray Fabius, he's the clinical piece. So he will be able to look at our data and give us recommendations. And then from there, we do have broker consultant partners who will be able to help us look what is available in the market, and who might be a suitable partner for the issues you're trying to solve.
So, sorry, Dave.
Yeah.
Can you also speak to your executive benefit team and the value that the best in class strategic partnership with Artemis brings to you with that team?
Yeah, absolutely. So our CEO, Steve Booth, as well as the healthcare subcommittee made up of senior leaders, really helps guide us down that culture of health path, and helps kind of break down any barriers or challenges that are ahead of us. And so they've been very instrumental in providing the resources. Health Next does come at a cost, but they've been very supportive to provide the resources. But in terms what it does for them, right? It's a partnership with them, is we're able to take this data and really come to the table and talk not about healthcare, but about solving business issues. So it's taking, the healthcare jargon sometimes that we run into, removing the jargon, being able to create a story for them that helps them see the connection between what we're doing from a benefits perspective to this broader culture of health, and then even to a broader business perspective.
Again, I think that's a great point. It's something that I think we hear a lot, that it's hard to engage our C-suite in a way they can understand healthcare. And so, this is an opportunity, Grant, maybe that's something that you can comment on as well, because, when you think about it from a true top of the house perspective, how do I get my CEO, my CFO to understand that it isn't just what is my health plan cost, but it's what does it mean for me to run my business, and how does Artemis really help get to that, sort of business conversation level as opposed to just a data reporting level?
That's exactly the right approach to be taking on this. And the reason why, that's exactly the reason why we decided to build Artemis, to incorporate so many different kinds of data, because it's so easy in traditional healthcare analytics to focus on those traditional, like, financial oriented reports, and it's super important, and you do want to manage those costs. But there are so many other costs and other advantages that you can get from running a really fantastic benefits program. And that's why when Sanjay was talking earlier about this console product that we're launching to measure the impact of programs. Well, what's the impact, right? Is it the obvious? Are we reducing costs for healthcare for people? But more importantly, are they at work more? Are the performance reviews going up? Are they more engaged? Are their internal NPS scores going up? Those are all things that you can correlate with programs and potentially even establish causation there. And so I think if you kind of zoom out and look at it from the perspective of a CEO, which I also happen to share at least in a small company, what are the kinds of things they care about, and what kinds of data sets can you integrate and tie to the benefit initiatives and let's say actions that you're trying to take? How do you show the connection there? That's a surefire way to really raise the profile of benefits at your company.
Thank you. Jeff, because you're here, I'm going to throw you on the panel for a second. BHCG as a coalition is obviously a conduit to the best-in-class solutions and creates a good financial value proposition. But I think it also has a mission for improving care and for helping its member employers really look for opportunities and to share information across, with each other as to what is being successful. Can you talk a little bit about how you've structured the Artemis deal to not only look at the financial opportunity, but also to think about how member employers can look at data across the coalition and look for opportunities and observations there?
Okay, thank you, Dave. So we, in building the contract with Artemis, we have a number of different tools that Artemis has put into place, which will enable BHCG to do exactly what Dave just articulated. So we will be working with Artemis to identify trends across our BHCG member employers that we can then take back not only to the member employers, but also to the to health systems and provider groups and independent physicians to drive improvement within their organizations. And without the partnership, and again, it's not a term that I use loosely, but without the partnership with Artemis, I truly don't believe that another data warehouse would enable us to do what we're going to be able to do to fulfill the mission of the business healthcare group, especially when it comes to and many of you have heard me say this time and time again, the business healthcare group looks to be a good corporate citizen for the state of Wisconsin. And this is going to help us move that forward also. So now I'm going to ask you a question, though, Dave. So when you look at, many of you are fully aware of what the business healthcare group has done with what we call the BHCG-GNS physician value study. And if you look at the opportunities associated with the deliverables from that study, Dave, and then you overlay that study, right, And there are many health systems in the state of Wisconsin that are utilizing the results from the study for physician value improvement. But then you overlay that study with the opportunities with Artemis. And how do you think we can augment both from an exponential standpoint to deliver value? And it's not only value for our member employers who are utilizing Artemis, but it's also value for Artemis and even more importantly for health systems and provider groups and independent physicians.
So I think we're gonna make Sanjay's life interesting as he looks at the next generation of product development, because I think this marketplace, this effort that BHCG has taken on is fundamentally a true healthcare improvement initiative. It is not just a question of how you structure benefit programs. It's not just a question of what you do as an employer. It is a question of how we fundamentally change healthcare. And so looking at that in a geographic marketplace, looking at how we get care to be frankly funneled to those who are the highest performing, how we bring up the performance of the provider community, how we can measure that change over time. Those are all initiatives that the BHCG has undertaken. The physician value study, I think, is a spectacular example of how you can use deep analytics to really look at performance at the physician level. And then you have to make it actionable. And you have to put it into, as the BHCG has done, a high performance construct that says, let's get our people to understand where and how they should go for care. Let's make it relevant to them, both from a financial standpoint and a quality of care standpoint. And let's do the same thing at the health system standpoint. So, it has to be real. If I'm a physician looking at results, it frankly has to matter to me. And part of that is it has to mean something to how my people interact, my patients interact with me. It has to mean something to how I understand my patient data. And it allows me to ask certain things of the employer community to say, I can do my job better if. And so I think we're going to look for some of those insights as well. And maybe I'll turn that back to a.
Can I, one follow-up? So as you listened this morning to the messaging from Sanjay and Grant and John and Kate, there's one word that really resonates with me, and that's collaboration, right? And it's the same thing in what the Business Healthcare Group has been doing, along with Centivo, in collaborating with health systems and provider groups and the independent physicians within Eastern Wisconsin. Can you take that a little bit further, Dave?
Yeah, I think we have seen a huge opportunity that go along with the open dialogue that has started to occur, that has said, all of the talk we've had for years about healthcare is broken and healthcare has a huge cost problem and healthcare is under delivering in terms of customer service are all true, and all have historically ended up with us sort of throwing our hands up in the air and saying, well, it is what it is, and we'll have to deal with it. And now the dialogue has changed. And it is said, if we can work together to inform our conversation with insights and to then create action plans that go along with it. And so, when, for example, Centivo and the employer community have quarterly meetings with the health systems, those data elements are really getting discussed in a very direct way, and action plans are coming together to change the healthcare. It does, I think, show that the opportunity for open dialogue that is data informed is really the solution to healthcare, as opposed to trying to impose something from top down. And from our perspective, that's been really impactful. And I think we'll continue to be, and we'll continue to manage that. Let me actually turn that into a question for maybe Sanjay and Grant. Your focus has always been on the employer community and some extent to support the health plan community. Do you see the extension of that to really looking at ways to work in a much more collaborative way with the provider community, with the health systems, with the chief medical officers and medical leadership of health systems. Do you see that as kind of fertile next ground for the opportunity to really add value?
Definitely. NOMI, being part of NOMI Health allows us to expand into, what we will call as the care domain. So certainly there are care services where, we have this open ecosystem approach where, we can look at insights and propose actions. So long COVID is one of those, incidentally, where we recently launched, an offering in partnership with providers, through NOMI and looking at, Artemis Insights. We all know that roughly 5% of the population, could be susceptible to long COVID. And, on an average, an employer could end up seeing an increase to the tune of $10,000 an employee due to long COVID. And much is not known, but the point being, using those data to come up with insights and then actions, which in partnership with providers can deliver that value. The area where I find a tremendous opportunity also is hospitals who are employers, and they have been dealing with value-based care initiatives. They are looking at data to really try to identify innovative models. And I think we have some of our partners who are exactly looking to do that, where as an employer, but also as a provider, they can do that innovation around, physician quality or physician value, so to speak, price transparency, social determinants of health. So these are areas that excite us tremendously. And what I heard previously from Michael in terms of the opportunity around physician side of value is greatly appealing to us. So we would love to partner more. We are barely scratching the surface there now, but I think the collaboration, as was alluded to, is going to be key to driving that innovation.
One of the challenges we've had historically around data has been the question of whose data is it really? And, there has been historically some pushback from some of the health plans and some of the owners of the data sources to say that's proprietary data, that's mine, it's really not yours as the plan sponsor. For those of us who've worked in the advisory community for a long time, we have often indicated our displeasure with that positioning. And so the question of, how do I get the health plan and my other providers to actually supply all of the necessary data to an organization like Artemis and to deal with things like data use agreements has been an ongoing challenge. I'm going to ask John and Kate to sort of address that in terms of what their experience has been. And maybe I'll start with Kate, because you have the most immediate experience here as you're setting up the world. Have you had challenges in getting the data that you need and being able to use it the way you want to?
No. And I think for some of this concept is very new, especially for our wellness vendors, our meditation, our gym membership. They're not quite sure what we're going to do. We need to educate them. So a little bit of pushback. They don't quite understand what we're trying to achieve, but once they're educated, we bring them into the fold, they get it. The larger data sets, fortunately, when some of those contracts were developed many years ago, there was the forethought to put in some provisions in terms of who owns the data. So that has allowed us to move forward very smoothly.
So whoever put that language in deserves a big bonus.
Yes.
What about your experience, John? Have you had some limitations, or have you been able to get the data you need?
For the most part, we've been able to get the data that we needed. Our core benefits, our medical and pharmacy, that was the easiest for us to have Artemis consume. The conversations really were more around of making sure that we had proper tri-party agreements, as well as if there were any fees associated with providing monthly data. everything there was very overcomable. The point solutions, though, are usually the ones, and this is the case point, that provide a little bit of pushback, especially, you know, our diabetes management and our musculoskeletal programs. They have the necessary data to share, and they do currently share. But it took us about 2 months of back and forth because their stance was, how are you using it and how are you determining an ROI, right? Are you going to determine an ROI? Because, you know, the point solutions all have very nifty reporting on, if you use this, it's going to be a 2-to-1 or a 3-to-1 ROI, right? You can take that to the bank. And then as you're bringing that information into the warehouse, it's all of a sudden like, wait, are you going to try to do this? You know, it might not match up exactly to our, you know, our assumption-based model, but we were able to get through all of that. So, you know, I would expect that there would probably be some pushback, but Artemis has been partnering with all of the major point solutions now, and I'm seeing fewer and fewer issues on that front. You know, for example, our wellness vendor, Virgin Pulse, they had no problem sharing the data. They're like, just tell us the fields you want and we'll send that over. We're seeing a little bit of pushback currently right now on our mental health provider, Lyra. And we do know Lyra is sharing data with other employers, but you know that I would say that my best recommendation on that front is, you know, is as long as you're being open and transparent with these third parties of what you're trying to do, how you're going to use the data, and how it's going to empower you as an employer to either increase your investment or show why it was such a valuable decision to make that partnership, goes a long way of them knowing that you're not just trying to misrepresent their information.
So Jamie, a time check. I want to ensure that we have enough time to play the demo. How much time do you need, Jamie, for the demo? I forgot. I'm sorry.
No, you're okay. I think 10 minutes would be awesome. I'm prepared to walk through that. So,
okay, how about if we start Dave,
Yeah,
any
let
follow-up
me just check
questions?
to see if there's any questions that have come in through the Q&A chat.
Yeah, I have, and I've actually been
Okay.
asking those as we've gone along.
Okay. Very good. Then yeah, why don't we go ahead and go to the demo, Jamie?
okay, great. Let me share my screen here. Let's see here. Okay, can everybody see my screen okay?
Yes.
Perfect. So super excited to walk through this with y'all today. It's a live demonstration, so feel free to, if you have any questions at the end, feel free to drop them in the chat. Intention today, though, is to really tie into everything that has been spoken of today. Dave, really appreciate your bucket analogy around data, around financial, clinical, point solution measurement data, and feature data. That actually ties really well with our product offering. And easiest way to think about the Artemis platform is we are really there to help you plan, manage, and measure the overall impact of your benefit strategy, as you've heard today. So I'm going to go through each of these, as you can see here, perspectives, cost advisor, console, and ad hoc analytics very briefly today, and give you a taste of what we're looking at here. So this is our perspectives application. This is our core offering where we're able to bring in all those different data feeds and be able to help make sense of that. Connecting data, as mentioned earlier, with a lot of our integrations is very simple, but it's being able to then take all that data and, as David alluded to earlier, putting that into action. And so we focus on really two primary pieces of our platform: out of the box content and custom content. Okay, so let's look at some out of the box content here. We look at standard stories. Standard stories are ready to go once you're out of implementation. So Kate and team will be able to have their hands on this very soon. So we have cards like executive summary, actionable overspending. You can see high cost claimants here in the middle. as well as network utilization, pharmacy, and population health. As I click into the executive summary here, you're able to see just a brief snapshot of your overall demographics and enrollment profiles. If you have multiple medical plans, you can see the breakout between current year versus a prior period, average family size. We also give you a quick snapshot on the financial profile of your plan, as well as the clinical profile. Are we getting healthier? What's the risk score of my population overall? So as I come back out to the standard stories here, we actually have additional components here. You can see pharmacy, network utilization, and population health. So those are some examples of the out-of-the-box content. Now let's move into that other bucket, if you will, of financial data. So we have our financial reporting solution. If I come back here, we call it Cost Advisor. So let's look at that for a minute, and I'm going to showcase that here. Cost Advisor allows you to really track your budget and put in your numbers, put in your fixed costs, any admin fees, any of those fees, and be able to report on those and track those over the year. So you can see that we're surfacing this in a nice digestible dashboard here, where we're at 79% of our budget. And if you look over here on the right-hand side, where our cost per employee is actually down 22% from last year in this example. And then we get a breakdown here of the overall fixed costs, med and RX claims, and then the total plan costs. And then we can also break that down by PEPM, again, year over year, last year versus this year. We're also able to see the budget breakdown even further. You can see broken out by month, and you can see those fixed as well as RX and medical claim costs here. We're also going to surface high cost claimants. So who's driving this? What's the overall profile of these high cost claimants? And what's their top diagnosis here? And much more. You can see plan utilization, enrollment by month, as well as by plan. And so our Cost Advisor application, again, makes that simple to input those aggregate amounts, the stop loss, as well as your plan costs and your fixed costs and all those other fees to create those nice digestible dashboards. While we're on the financial topic, let's look at another standard story here. We call it actionable overspending. And I did want to call out, as we had a discussion during the panel about different levels of users and access. So the nice thing is again, because we have those two different areas of out-of-the-box content as well as custom content, there's an application for everyone, right? All the way from Rodney, the CHRO, all the way down to your data scientists, your actuaries, or your analysts, right? And so actionable overspending is one of those, again, out-of-the-box stories that we're going to surface to you and enable you to see dollars that are essentially left on the table that we could do something about. And we spread these across these 5 different stories. And you can see here as we click into one, avoidable ER, this story is specific to, people that are going to the ER unnecessarily. So if we could have gone to a telemedicine or an urgent care facility or their PCP, based on the ICD-10 codes that we're looking at here, you can see people are primarily coming in for unspecified abdominal pain and headaches and dizziness and giddiness. So looks like a lot of tummy aches and dehydrated people out there in this example. So if I want to explore this data or look into this data further and see what else is primarily driving this 3.7 million, I can then go into explore. And this is where we start to blend the two of the out-of-the-box content as well as the custom content that your team and those folks, those data scientists, are able to really start creating their own custom and really diving into the data. So in this example, we're looking at, again, those ICD-10 codes, the total sum of the avoidable ER spend. We also have other breakdowns applied to the data here. You can see the breakdown by office as well as medical plan. So if I want to come in here and I want to add a different measure, I can easily do that. Let's say I want to come in here and look at just overall member and how many members apply to this data. I can easily apply additional measures here. I can also apply breakdowns. We already have office. I'm not going to do state. Let's do some maybe social determinants of health information here. So let's look up wage. And I want to apply the wage tier breakdown across this data set here. Okay, so you can see that down here below. So the idea here is once you have the information and the data that you want, you can then apply it or create a visualization. You can then create something that you can share or you can add to your analytics library. So in this example, a simple bar chart here, be able to name the bar chart, and you have created your first visualization, your first breakdown of the data here. Other actions that we have, you can save these members as a cohort. So if you want to track these folks over time, if you want to even dive into the medical claim lines or the pharmacy claim lines, you can do that. We can even take it down to the member level if you want from this page. So if I come in here and I just click on one of these members as an example, I'm able to see their profile. I'm able to see their medical claims data, their pharmacy claims data, what their risk score is. Are they visiting their PCP? Are they considered a high cost claimant? Are they flagged as that? So you can get all the way down to that level. And at any point, speaking of partnership here, at any point when you're in the data, or you're exploring this, or you maybe want to raise your hand and ask for help, we have our interactive chat here. Okay, our chat is fantastic. Our support team is amazing, and they will be able to respond typically within 90 seconds. And someone will be able to help you build out these visualizations in this example. Okay, the last component I wanted to walk through, just given our time here, is the console application. So Sanjay spoke to this. Dave, you mentioned this at the beginning, be able to really see the true ROI on point solutions that employers have in place. Okay, so we have built Artemis console, so I'll go to now. And this allows you to really see, are my programs, are they performing well? So let's look at this Align Wellness as an example. This is a mock version of an MSK solution that is in place. Okay, Align Wellness is not a real company, but as I can see, we're going to give you a quick overview of how this program is performing. Okay, what are my overall orthopedic costs, my total medical and pharmacy paid amounts, and my places of visit. Again, this is a quick little overview. We have detailed versions of these down below. We're also going to call out comorbidities. You can see, joint degeneration and hypertension, and how many of our folks enrolled in the program have those comorbidities tied to their profile. We're also going to highlight the study here. This is an important component I want to just call out here, because what we're doing is we're doing a true apples to apples comparison when you think about measuring folks that are engaged in the program versus not. Okay, so the idea between the apples to apples is to make sure that they are the same person or the same clinical profile, I should say. So same age, similar gender, or same gender, annual salary, okay? And they match those two criteria. And then the only difference is am I engaged in the MSK program or am I not? Okay, so you can see that we have 86 of 115 matched folks inside this program. Then we start to really break down the data across a few different categories like engagement, cost of care, member satisfaction, and financial impact. So the program engagement, you can see in this example, we have a 2.7 engagement, which is very low. You can see the breakdown of gender as well as member type and location. But we have the ability to set different targets here. So if I want to set, I have a 2.7 engagement, but I want to set a target of 18% in this example. We allow you to engage with the content on this page and be able to set your own targets. We're going to call out the financial impact. So again, same idea, I can set different targets. So a lot of the data is broken out in these three different bar graphs here. And I'll just simply call this out. You can see our financial impact for this program is actually doing well. So our medical allowed PMPM before we implemented Align Wellness was $13.82. Our control group, those that meet the criteria, the member matching criteria, but are not engaged in the program is 1345. Our treatment group, those that are engaged in the program that meet the clinical profile, is 1268. So we've seen a decrease of 5.7% on our allowed PMPM. So we're going in the right direction. We give the same idea for places of service. You can see, are we trending in the right direction? Outpatient versus inpatient, ER visits, urgent care. Kind of scroll through this here quickly. Categories of cost. What's our PMPM for surgery, imaging, physical therapy? Categories of cost, more here, surgery, pharmacy. We're also able to see how are we impacting pharmacy, prescriptions, pharmacy costs. Are we seeing a decrease in those numbers? Then we're going to actually highlight the MSK system. Okay, we're going to see, okay, based on the programs, where are our target points? Where are we focusing? Where are the claims coming in? You can see neck claims, low back claims, shoulder, elbow, hip, knee, hand, wrist, ankle, and foot. And then we're going to, last but not least, focus on a few clinical outcomes here. You can see pain reduction. Are we going in the right direction? We're going to tie into risk score as well. And then we're going to also monitor clinical outcomes based on mental or behavioral health here. So in these two examples, we are tracking, are we seeing an increase or decrease in anxiety as well as depression here? And then the last piece is just overall member satisfaction. So we want to know, are the members, of Baird in this example, are they happy? Are they satisfied with the program, with the MSK program that is in place? Okay. So overall, that is a brief snapshot and overview of the Artemis platform. Again, just a 30-second recap. Perspectives is that core offering where we have out-of-the-box content as well as that custom content that you can create. Financial reporting, you remember that, where you can build out your budget and make sure you're tracking over time. Console is that point solution piece that we just walked through, be able to make sure that we're seeing ROI from an objective third party like Artemis. And then the last piece, I'm not going to show you today, but ad hoc analytics. We have the option to give you access to the raw yet enhanced data inside your own data lake. So if you have those data scientists or those analysts that really want to roll up their sleeves and dive in, creating SQL and using Power BI to help visualize the raw data, we give you that option as well. So that is the Artemis platform in a nutshell.
Thank you, Jamie. Any comments from any of the panelists this morning or Dave concerning what Jamie just shared with us?
I'll just offer one comment. So when we first started engaging with Jamie and his team, I said to him, Jamie, who is your best Artemis client? Think of that client. Don't tell me who it is, right? Who is your best client? We want to be one step better. So you need to get us there. And it wasn't a forethought. It just kind of came out, blurted out. But I think that's the value of the partnership, like we talked earlier. So I'm going to hold him to it.
And again, the special word collaboration.
Absolutely.
Right?
Yes.
We definitely are committed to that. Thank you.
John, any closing thoughts or Grant?
No, just really, really appreciate the time today. We're so excited to work with you all and find a way. No, if you want to be our best customer, we want to be your best partner.
Yes.
We're really excited about digging in and kind of doing the hard work brick by brick of helping to fix healthcare together.
Yeah, and just to wrap, for any new client, Jamie is such a pro and he's working through this very quickly. But in about 6 months to a year's time, as you kind of understand how everything works, it becomes very intuitive, and you'll be able to work with your, usually your technical lead to be able to navigate in such a manner where you can do the things that Jamie was doing. I think that's one of the things that I was really pleased with in the partnership, that when I saw, a demo just like this, 3 years ago, it was actually like that when it was our data, and that we could do things that quickly and identify problems and solutions on the fly like that.
And Dave.
Hopefully people have seen sort of the art of the possible here. One of the huge pluses of Artemis, I think, is they have spent the time and the calories, frankly, to make this usable for those people who don't spend all their life in the data world, which is really important. I think Jamie in showing the demo did a nice job of indicating that this can be translated into real life English as opposed to a bunch of data speak, and I think that's really important. So looking forward to the continuing connections here from the business healthcare group side. One of the huge pluses as we grow the group of member employers that have this solution in place is that we can actually create data insights for the community as well as for the member employers, which is hugely beneficial from the BHCG perspective. And so very encouraged by where this is all going.
So thank you, and Dave. And I'd like to thank all of our panelists and Grant as a presenter also this morning for the time commitment that you put forth in making this happen. And even more importantly, I'd like to thank all of those who have joined us this morning for taking time away to learn about this new best-in-class strategic partnership that is available from the Business Healthcare Group. And would also like to reiterate it once again, we have a number of other best-in-class partnerships which are available with Centivo, with Navitas, and with Quantum, Teladoc, Best Doctors. And if you have any interest whatsoever in moving forward on any of the best-in-class strategic partnerships, you can certainly outreach to myself. And it's obvious that it also pertains to Artemis. And we are truly looking forward to the journey that we will go on with Artemis. And Sanjay, I can assure you that I'm going to be, as soon as I get back to my office this morning, Sanjay and Grant, I'm going to send you information on the BHCG-GNS physician value study for you to be able to start to evaluate it and see how we can incorporate it with the partners that you have in place within Eastern Wisconsin. So with that, I'd like to thank all of you once again and have a great day. Bye now.
Thank you, everyone.
Thank you. Bye.